Hi everyone, Lynn Schulte here with the Institute for Birth Healing, and today I'm in my Denver location, and I just wanted to make this quick video because I just got done seeing a pregnant mama, and we started talking, and I'm like, oh, I need to make a video on that. So this video is all about pain in your body during pregnancy. So during pregnancy, your body needs to expand. Tissues need to expand. And as baby's growing, uterus is growing, it's taking up space. And then those organs and tissues in your body have to accommodate. And if they can't accommodate, it's going to cause pain. So depending on where that pain is, may indicate that there may be more challenging birth in store for you. So, doctors like to just dismiss any kind of pain during pregnancy as, oh, well, you're pregnant, you just need to deal with it. But I'm here to tell you that if the body can't expand and it can't move, then it may inhibit the baby from being able to get into the best position possible to come out for your birth. So I'm all about helping women have a smoother birth, okay? Make it easy as possible on mom. And so, one of the things that can cause problems is any restrictions in the abdomen. So, a lot of moms can have pain up here in the ribs, as baby starts lifting, pushing up into this area. Pain in this area can cause problems, but it can cause pain and discomfort, but this isn't going to inhibit your birth. Okay, but if you're having pains in the lower belly, down low in your groin area, or those round ligament pains, that is a sign, especially if it's always on one side. And if your baby is stuck on one side, the baby never moves to the other side, those are all signs that the baby might not be able to get into the best position to come on out. You need to get body work done. You need to find someone who can do releasing work to the fascia, to the ligaments, to the organs in your body. The uterus, we need to work on your lower abdominal fascia. We need to work on your uterine mobility. We need to release your uterosacral ligament. And those are all things that I teach in my pregnancy and postpartum courses. So, if you are having any of these issues, if you can check out my directory on my website, I've got a list of all the providers who've taken my courses. Please check that out and go see one of them. Pelvic pain, low back pain, very common during pregnancy, but it's not very common, but it's not normal. Pain is a sign of dysfunction, meaning that something's not happy in your body, and we need to help it to be more happy. So we either have restriction or we have too much looseness from the laxity of carrying a baby and the pregnancy hormones. And so we need to determine what's really going on. If we're having pelvic pain because of dysfunction, then we need to be thinking about, can the pelvis open up to do what it needs to for birth? So these are all the things that I'm looking at when moms who are pregnant come see me prior to their births. I want to make sure that their pelvis and their bones can move like they need to for the birth. I want to make sure your pelvic floor muscles are relaxed and we're not holding tension on either side. I want you to think about the sacrum in the back. If this is your sacrum, the sacrum needs to lift backwards evenly. Think of it like a garage door open, but like the swinging ones, right, that open up like in the olden days. If the pelvic floor muscles attached to the bottom of this, if there's too much tension on one side, then that door's only going to be able to open up evenly it's not going to open up evenly. It's only going to open up on the side that can move. And so those pelvic floor muscles, they inhibit that sacrum from moving back evenly, and then babe kind of comes through a little cattywampus. If it can open up evenly, then the birth is going to be a little bit more smoother for baby to come on through. So that's my whole goal, my whole intention in working with pregnant mamas prior to birth is, let's make sure the pelvis and the bones can do what they need to for birth. Let's make sure the pelvic floor muscles have even tone in it and there's not too much tension in one side versus the other. And then let's make sure that baby can get into the best position possible by having as much freedom of mobility in those abdominal tissues and uterine tissues so the baby can wiggle and get into the best position to come on out. It absolutely kills me that moms go into labor. They start labor with the baby heading into one hip. It's like the baby's head needs to be directly midline into the opening of the pelvis before you go into labor. If the baby's head is heading off into a hip, there could be restrictions that are keeping it from finding that midline passageway. And so let's release those and get baby into midline before you start labor. Those are all the things that I want to help moms do so that they can have a more smooth birth and baby can come on out more easily. So I just want you to know that if if you have pain, that's an indication that something might be in dysfunction and needs some help. And some providers just dismiss it. And I'm just here to say, go get body work. Go find a practitioner that can help you release whatever restrictions need to be released so that you can have a smoothest birth possible. Okay? Thanks, everybody. Check out my directory at instituteforbirthhealing.com, and also my courses. If you're a practitioner, please come check them out. I'd love to teach you how you can do the same, okay? Thanks, everybody, to more beautiful births and more complete recoveries afterwards. Take care. Bye-bye.